In this recording, we're going to discuss several vessel disorders. The first one we're going to chat about is cerebrovascular accident, or CVA, also known as a stroke. Strokes are caused by disruptions to blood flow, specifically to the brain, and there are two main causes of CVAs. One, you could have a blockage of an artery in the brain due to a blood clot, or you could have a loss of blood or hemorrhage due to a ruptured cerebral artery in the brain. In our image here, you can see there is a cerebral aneurysm in this vessel. An aneurysm is a weakened vessel wall, which allows for blood to balloon outwards. Okay. If this continues to balloon outwards, the increase in pressure and volume could eventually cause this aneurysm to burst or rupture, causing blood loss into the brain itself, which would reduce blood flow through these branches of this artery, which would reduce blood flow to any part of the brain that these arteries normally feed. Atherosclerosis, which is hard to say, is one of the leading causes of death worldwide in developed nations. This typically occurs in large to medium-sized muscular arteries, and these are characteristically distinguished through atherosclerotic plaques, which is even harder to say. These plaques are formed from lipids, cholesterol, calcium, salts, other cellular debris that build up within the tunica intima of the arteries themselves. So you can see in our image we were starting to have these fatty deposits, and they continue to build and build and build. These plaques are reducing blood flow by narrowing the artery, which would increase peripheral resistance, which would increase your blood pressure, all that kind of bad stuff. These plaques tend to form in locations where the blood either changes velocity or direction very quickly. This happens a lot in branching points or where you have curves within the vessels themselves. Not only are we reducing the blood flow by narrowing the artery, but the artery walls themselves become harder as the tissue becomes less flexible. There are a few different types of shock that we're going to mention, but overall shock is a loss in blood pressure, which would reduce the oxygenated blood flow to cells and tissues of the body. We have a few types we're going to discuss: hypovolemic, cardiogenic, anaphylactic, vascular, and septic. Signs of shock, you can see some are relatively easy to understand. We just mentioned this was lower blood pressure. We could also see an increased pulse rate, increased anxiety levels, cyanosis due to the loss of blood flow to certain areas, things like that. Now, shock we said was a low blood pressure, so let's differentiate low and high blood pressures. Hypertension would be a high blood pressure. Essential or primary hypertension, the cause is really unknown. There could be a lot of genetic factors in play there, but secondary hypertension, we can determine the cause. Perhaps it's the atherosclerotic plaques or something like that. Hypotension, which is where the shock comes into play. This is defined as your systolic pressure being lower than 90 millimeters of mercury and or your diastolic pressure being lower than 60 millimeters of mercury. We tend to really only diagnose this if you're actually showing symptoms of hypotension. Otherwise, we might not really even know you are suffering from hypotension unless you're seeing your doctor very regularly and they're taking your blood pressure. So, shock. We mentioned we've got several types. So, severe hypotension or circulatory shock. This could cause a loss in consciousness and even organ failure, because your blood pressure is so low that we are delivering insufficient quantities of oxygen and nutrients to your cells to keep them alive. This could actually be rapidly fatal. The most common cause of this would be a reduced blood volume, or hypovolemic shock. So you are either losing blood itself or fluid from the blood, from maybe excessive diarrhea or vomiting, Perhaps you are overusing diuretics, or an insufficient fluid intake, or severe dehydration. All of these would cause the decreased blood pressure. The severe blood loss could lead to hypovolemic shock. Okay, and again, the hypovolemic, hypo-low volemic, or volume. Okay, so we have reduced blood volume for some reason. Now, severe heart failure could also produce a dramatic drop in cardiac output. Okay, remember, cardiac output is directly related to your blood pressure, so the lower your cardiac output, the lower your blood pressure. If it is bad enough, this could lead to the cardiogenic type of shock. Decreased heart rate could also lead to hypotension. Remember, heart rate is directly correlated to your cardiac output, and again, the lower your cardiac output, the lower your blood pressure. Okay. Sometimes this is caused by medications used to treat hypertension, so sometimes they work a little too well. Maybe we haven't gotten your dosage adjusted correctly quite yet. Decrease in stroke volume, most commonly caused by heart failure, so we're not pumping out enough blood. Okay, so decreased stroke volume would decrease your cardiac output, which would decrease your blood pressure. Okay. Excessive vasodilation can lead to hypotension. This could be caused by hypertensive medications as well. Again, maybe we haven't got the dosage correct quite yet. Perhaps we have problems with your autonomic nervous system, or a decrease in blood pH. Okay, and again, we're going to go a lot more into blood pH discussions in both your respiratory and your urinary system. We could cause excess vasodilation due to chemicals. So histamine, we've mentioned histamine is a potent vasodilator. In the past, we release large amounts of histamine when you are suffering from allergic reactions. This would be the anaphylactic shock. Okay. Or we could have excessive vasodilation due to bacterial infections, and this would be the septic shock that we've mentioned. And that covers our discussion on several common blood vessel disorders.